Welcome to ZOOMERTIMES TV. And here's your host, Anita Finley.
Hello, everybody. I'm Anita Finley, your host for the ZOOMERTIMES TV presentation by Boomer Times. And I have a very unusual guest today. He's not unusual, but what he does is unusual. He is a chiropractor, but he isn't a typical chiropractor. Yes, he will do that, but he has forged ahead something that is so important here in South Florida. For those of you who walk a little crooked and you ask them what's wrong, oh, I have such terrible knee pain, I'm probably going to have an operation. Well, just stop. Don't do anything yet. We want you to hear Mike Rozenblum, who really has an answer, a possible answer. He never assures anyone, but we're going to have him tell you about what he says in his testimonial here in Boomer Times. It says chronic painful knee pain reduced in less than 8 minutes. Now, this is not a joke. This is real. And I want to introduce Mike Rozenblum. Thanks for joining us, Mike.
Thank you. It's my absolute pleasure to be here. And quite so. For the first time ever in my career, my professional career, we've developed a system or a program where we're able to sit with a patient for approximately 1 hour of duration and be able to sincerely look at them in the face and say, yes, you are a good candidate for the program that we have in our office for chronic knee pain, or you're not. And that's something that's very exciting, especially having been a doctor for almost 30 years. So a lot of times we just can't predict how someone will do with treatment until we actually undergo a course of treatment. But with this new program, we're able to do an evaluation, a consultation, include an x-ray, obviously, to evaluate the knees. And then after doing a very brief test treatment, be able to know with a great degree of certainty who is and who is not a good candidate for the program.
Yes, and I was privileged to go through his center, and I saw all the equipment, and he explained carefully to me what he does. I was impressed, and I don't do this casually because our readers have been relying on us for over 30 years, and our used to be radio interviews, but now we have Zoomer Times interviews, so you can actually see the doctor, the guest right here. Now, Mike, when you were practicing before this and you were helping people, you thought, with knee pain, hip pain, what made you get so interested in this? And I have an idea of the answer, but you tell me.
Well, what became frustrating to us, what became frustrating to me was the fact that once a patient got into a position where they were sort of bone on bone knee pain, our resources back then were limited, and we had no other option, other than to recommend the patient would go for what usually ended up being some type of a knee replacement surgery. And so for us to be able to now offer a possible alternative for people that are suffering with debilitating and chronic knee pain has just been an exciting thing for us personally, not to mention our patients.
Can you explain a little bit about what it entails and what you do?
Yes. Essentially, the knee, of all the joints in the body, the knee is actually quite a simple joint. It's essentially like a door hinge. It has two jobs, right? It needs to open and it needs to close. And so when we evaluate the knee at its most basic format, we know that there are muscles, approximately 12 muscles, that need to function in unison for that hinge to sort of open and close. And so we look at the condition of the surfaces. We look at the joint. There are different parts in the knee. You have the space in between the one bone and the other bone. If I may here, I'll just use this.
Yeah, we like that. Do that. Sure.
So you have a long bone in the knee called the femur. And then underneath it, you have something called the tibia. In between, you have a space that's known as the meniscus. And inside of the knee, there's a whole bunch of different ligaments that hold the integrity of the knee. But as I was mentioning before, the knee essentially is intended to close and to open. Now, you could understand, if you use the analogy of a hinge, that if that hinge is out of alignment, if there's any type of rotation happening in that hinge, it won't function well. So we evaluate the quality of the joint. We look at whether or not the two long bones that make up the knee joint are properly aligned, make sure that there's not a lot of twisting or rotation. And then we also have to take into consideration the inflammation that can exist between the two spaces. Oftentimes, whenever we have pain in the body, it's secondary to some type of inflammation. So our knee program does not include any injections. It is non-surgical. And it is really intended to be a long-term solution to a chronic problem. And it's not a magical program that just you come into the office and we do something for 1 or 2 visits. We actually utilize technology that is given to the patient so that some of the treatment is rendered by the patient in the comfort and safety of their own home. And then some of the components of treatment that can only be performed in our office are performed in our office. And so we kind of split the duties and the responsibilities with the patients, ensuring that they will have a long-term relief to their condition, because once you have a degenerative problem in the body, it's not going to go away. Our whole idea is to be able to retard the process and to be able to slow it down as much as possible. And so many of our patients enjoy wonderful relief because they continue to do some of this therapy at home.
Yes, and so there, again, I'm going to repeat, there is no surgery, right?
Correct. There's no injections. There are no surgeries. There's not even any prescription medications. We utilize creams that are intended to help with circulation and reduce inflammation. We use technology with anti-inflammatory wearables. We provide bracing for home, exercises, and of course, all of the technology that is necessary in order to help the knee feel and function better.
Is there a name to this product that you do?
Really, there really isn't a name. We use an LED technology in order to help reduce the pain and the inflammation. In order to help increase, sometimes when the knee joint is bone on bone, we utilize a table called the Neon Track. It's actually a knee decompression table that helps increase the space in between the two articulations. We use a machine called a muscle or nerve rebuilder. It's actually called a rebuilder unit. It's a neuromodulation machine that helps really to synchronize the neurology of the knee with the neurology of the brain. The brain does not like pain anywhere in the body. In fact, the transmission of the body that is the fastest as it pertains to nerves is the transmission of pain. This is why when we touch something that's painful, we so quickly retract, because the brain doesn't process, it bypasses having to think about whether or not something hurts. It immediately wants to get away from it. So when it comes to chronic knee pain, the brain's been getting all this messaging about the knee hurting all the time. And it tends to alter how we walk and how we get around. And everyone that has knee pain is familiar with that. And so this machine helps to resynchronize the neurology between the knee and the brain so that as the joint is starting to feel better, it actually functions better as well.
You brought up a good point, because as the people are walking, they are starting to, of course, in pain, and they're then affecting their hip. The hip that was fine before now is going to be affected also. So we don't want to wait. That's the whole key, that people are amazing. They'll say, well, I'll think about it tomorrow. I'll think about it next week. In the meantime, this is here. This is here and now.
That's
and
right.
You are in Fort Lauderdale. Tell us,
Right.
Tell how easy it is to find your office.
It is so easy. We're almost right across the street from the Fort Lauderdale Executive Airport, right on Cypress Creek Road. So easily accessible both from the Turnpike and from I-95. We're almost like right in the middle of that. The closest cross streets, I would say, are Lyons Road or 31st Avenue and Cypress Creek Road. We're very, very close to that intersection. And, I love our office. I'm thankful to have our office. It's very comfortable and spacious and clean and modern environment. And so I think that, if we're going to spend the day working, I'm really happy to be able to spend the day here. We have awesome staff, great patients, and we're really happy. I mean, it's just right now a matter of just helping other people find out that this option exists. And it'll only take an hour of your time to be able to identify whether or not someone is a good candidate. A lot of times people will call us and they'll say, I have this problem and my doctor told me this and I've had this surgery. Can you help me? Well, I'm going to tell you in advance, the answer is always going to be the same. We don't know whether or not someone is a good candidate until we examine and evaluate their case.
So I'm going to give you a phone number. It's really important. Remember, you have to write this down. We used to do radio. We used to say, this is talk radio, and just write it down. But no, this is now Zoomer Times, and this is the number. Get your pencils, put it on a piece of paper that's going to stick to your desk, and it's not going to fall off. It's 954-977-0888. Now I'm going to do that again. 954-977-0888. And this could really be the miracle. It's, I hate to use the word miracle, but it could be a miracle if you're suffering and you don't want to have knee surgery, which my husband had many years ago. It means probably 20 years ago. I wish we knew Mike then and Mike had this, but I do have a question for you, Mike. There are people who've gone through the knee surgery and they're not happy. They come back and it didn't do a good job. Are there any instances that you can help them even after they've had the surgery?
Yes, I am very, very happy to say emphatically yes. In fact, we treated a patient just about 6 weeks ago who had had a knee replacement on one side and was about to have another knee replacement on the other side. Her one hesitation and the reason why she was looking for a different option is when she had her first knee replacement, she lost all sensation in the knee. And you can imagine that if you don't have sensation in the knee, walking becomes really, really cumbersome. So she was very concerned about that. Been about a year since her knee replacement. So she came into our office and she said, I'd like to do an evaluation and find out. To make a long story short, we accepted her case and we began to treat both knees, both the knee replaced side and the side that had not been replaced yet. And it was nothing short of a miracle, really, for us that the patient began to not only experience relief on the knee that hadn't had the surgery yet, but on the surgery side, she began to regain feeling and function. Today, she has full feeling on that right knee. I mean, it's a real person. Her name is Linda. She's given us a video testimonial. She exists. It's not just a story that we're passing along. And so it's really a remarkable option that people have even after having had surgery. And sometimes, surgery can be very successful and people are satisfied, but unfortunately, more often than not, the success, if any, is short-lived. And so it's nice to have an option. I believe that all elements of healthcare are really valuable. There's a time and a place for almost everything, but we always recommend to our patients that they ought to consider doing the least invasive procedures first. I'd much rather see someone prior to having surgery than after having a failed surgery. But, everyone's case is different. Their circumstances are different. The scenarios, their history, even their body types matter. And so all of these factors are taken into account in order to be able to determine what should we do next. In light of our past experience, our present situation, and our future goals, what is the wise thing to do? And that's really the approach that we take with our patients to be able to direct them properly. You were saying a minute ago that sometimes people are funny and they think their problem is just going to magically resolve. And when I was in school, I had a professor that used to say the 5 most dangerous words that a patient can say is, maybe it will go away.
That's true. Yeah.
And sometimes, weeks and months and even years go by. I sit across the couch from a patient and I'll say, how long have you had this problem? They'll tell me 5 years, 10 years. And I just think, wow, what a long period of time to go through and be enduring pain. We believe in our office that everyone deserves to feel great. It's actually written on the wall of our front lobby because I do believe that. I've never met anyone who, because they were 50 or 60 or 70 or more years old, that somehow that became an excuse to hurt. And so I encourage people that are listening to this program, if you're hurting for some reason in some way, it's not right. There's a cause to it. Try and identify the cause of the problem and get it fixed, because you deserve to feel great. That's just the way that I believe life is meant to be lived.
My guest is, and he is so passionate. I love talking to him. Mike Rozenblum, and his phone number is 954-977-0888. I want to tell you a little story. We sent out what we call a shout out with your beautiful ad, and we did get response, but one particular person who's now in Atlanta, he used to live here. He said, "Why are you sending this to me? You know, I've already had 2 knee replacements." And he said, "I only wish," it made me very upset. "I always was looking for something else than an operation. I only wish I knew about this before. Stop sending it to me." And that's true, you know. And the other thing I want to tell you is I've known a lot of orthopedic surgeons, and one orthopedic surgeon became famous for revisions of knees because a lot of them didn't work, and he had to go back in there and do a lot of things. So, you know, it's not a cure-all. Just you know, you go through pain, suffering, you go have a surgery, and voila. No, it's not like that all. So if you could try this first. Let's just say you're dealing with an orthopedic surgeon and you have plans. Just put them on hold and go see Mike Rozenblum. Go see, it's called Genesis, by the way, I didn't say that. It's Genesis Physical Med and Chiropractic, right?
That's correct.
If you just go see Mike, and he is the founder, he's the owner, and he's going to take care of you personally. He has other people there, but for this particular I won't call it operation system, he will be doing all this. He'll be asking you the questions. He'll be working with you. And I just, I mean, listen, I'm not doing this casually. I went there, I saw it. I believe he can do it. And if I had bad knees, I'd let him do it. Thank goodness I don't have them right now.
We're happy you don't have bad knees. That's totally great.
But I just think, as his ad says here, chronic painful knee pain, reduced in less than 8 minutes. When you say chronic, what does that actually mean when someone has chronic?
So the word chronic means that it's been going on for a long time. If somebody, for example, let's say that one of your listeners was out walking or playing some sort of sport or pickleball or something like that, and they immediately injured their knee, that would be an acute problem. And I would recommend that in those circumstances that they would go to their primary or even see an orthopedist, because we don't deal with acute knee problems, meaning that they just happen and it's hot and it's painful and it's swollen. They need a proper orthopedic evaluation, and who knows from there, right? But what we're really focusing on are the patients that are dealing with long-term, long-standing problems, especially when they see that they're getting a little bit worse. I'll give you an example of a chronic knee pain sign. It's something called movie theater sign. If you sit down for an hour or two and it becomes really difficult to get up because your knees are so stiff and sore, that's one of the most telltale signs of somebody suffering from chronic knee degeneration, from chronic knee joint problems. And so there's different things that indicate a problem over long period of time. That's a chronic problem versus an acute problem, which is something that happened. Oh boy, I twisted, I hurt myself. It didn't hurt me an hour ago, but I hurt right now. That's an acute knee problem. We specialize we specialize in chronic problems and not acute. If you've injured yourself within the last week, go see an orthopedist, go see your primary, and hopefully you can get some relief. But if a problem doesn't go away within a month or so, then now begins a transition into more of a chronic knee pain.
Well, let's just go back for 1 second. So let's say someone did fall, and put your medical hat on, though. When they get home, should they use heat or ice?
Oh, thank you for asking that, because there's so much discussion about this, and my grandmother and everybody, everybody has an opinion, right? Let me tell you this: whenever there's inflammation anywhere in the body, whether it's an hour ago or 24 hours ago or 100 hours ago, the thing that helps reduce inflammation is ice. Now, ice, interestingly enough, has to be administered locally, properly, and safely. So what do I mean by that? You put ice over the area, not directly on the skin, because if you put ice directly on the skin, it has a tendency to burn the skin. It's too much cold for a long period of time, begins to act like heat. And so we always recommend to our patients, you want to ice anywhere between 10 and 20 minutes, for sure no more than 22 minutes. And you always want to use a thin cloth, a thin layer of material. A pillowcase is kind of ideal between the ice pack or ice bag and the surface of the skin. And then you do that for anywhere between 10 and 20 minutes, and take it off for an hour, and then you can repeat again. But in the body, there's something called the Huntington reaction. Huntington reaction says that if you constrict the blood vessels long enough, ultimately they dilate. There's an override system, and ice can begin to act like heat. This is the premise behind something like frostburn, where you have somebody that's so cold for so long that their body part actually burned. And so that's what we're trying to avoid. So especially for people that might be suffering from neuropathy or things where they're feeling their sensation is not very good, you want to be very careful that you don't just put an ice pack in an area and leave it on there for too long, because it could actually hurt the surface. So ice 100% of the time, never, never, never heat. I'm never a proponent of heat.
Oh, that's interesting. Okay, well, see now, and unfortunately, he feels better.
Yeah. Oh, no.
It's not doing the job, but it feels better at the moment, doesn't it?
So let me explain that, because I think you bring up a really good point. Heat helps to increase circulation. And oftentimes when we increase circulation to an area, it does feel better. But if there's an inflammatory process, then by definition, heat will make that inflammatory process worse. At least that's been our clinical experience and many of my colleagues around the world. And so if there was a way that we could ice the joint and heat the muscle, for example, boy, we would have solved all of the world's problems. But because of the fact that they sort of are in the same location, then we don't have the ability to do that. So we choose ice over heat in order to help reduce inflammation.
That's great. Well, we didn't rehearse this. I just know that Mike's very smart, and I know I've heard this. And I'm so glad you handled that, because we're not talking then about actually, wait, I have to go back to something else you said. How many people you say you see sitting, and when it's time to get up, someone has to help them up?
Yeah.
Because, their knees are just killing them. They'll say that my knees are killing me. Now, a lot of them will be using walkers, which help that they don't put the pressure on their knees. But a lot of people don't want to use walkers. It makes them feel old, and it's they can't do everything they want you to do. So this is really such an easy way to go and do this. This is called it's Genesis. That's the name of the process. It's the Genesis knee
program.
knee program. Okay, Genesis knee program. It'll reduce, and just imagine, reduce in less than 8 minutes the pain. If you go and you take care and you do it properly. How long would you say it will take someone? Let's say they come in and you start working on them. Are we looking at a few months?
Yeah, the average treatment program is anywhere between 2 and 3 months. During that time, we will often see patients at first half of treatment a couple of times a week in the office. And as soon as possible, we try to get them down to just once a week for their therapeutic treatments. Now, their treatments at home happen on a daily basis. And so we provide the equipment and we train them on the use of the equipment. Patients that are very severe will do treatment at home twice a day. We recommend that they do it in the morning and in the evenings. And as their symptoms start to get better, then they'll reduce the frequency. Once patients complete our program, they may only provide themselves a treatment at home, maybe I would say once a week or once every other week. And then office visits for just checkups will happen anywhere between once a month and once a quarter. So the treatment, I believe very much that treatment needs to have a beginning, a middle, and an end. And once we complete the care program, then people transition into what we call a preventative maintenance care plan, where they just want to keep an eye on things to keep them from getting bad again.
Well, let's talk about some of your patients. You've been doing this for a while. So let's say someone now is free from pain. you will have them come back. I mean, do they wait in case they get pain again, or you want them just to continue on a?
So, so if someone has completed the program and they're 100% pain-free, we might recommend that they would do a treatment at home probably once a week, anywhere between 1 to 4 times a month. And we would recommend that they would come into the office just for a checkup approximately once a quarter. Somebody that doesn't have any symptoms doesn't need anything more than that. But the key is this: if a person has any type of dysfunction in the joint, it's not beneficial to wait until pain surfaces. Pain is typically the last thing to show up and the first thing to go away when there's a degenerative problem. And so we have the ability to evaluate the joint. And if we identify some type of a dysfunction, a misalignment, some rotation, then we're able to correct that before it becomes symptomatic. And to me, one thing I've learned about healthcare is that preventing a problem is way, way more successful than treating a problem. And so if we can wait, if we don't wait until the symptom arises, our management of that condition is going to be much better than if we say, well, when I hurt really badly, I know what to do. It's a sort of a paradigm shift to say it'd be ideal if we all could learn to think and say, at the first sign of a symptom, something's wrong. God's given us symptoms to pay attention to them. Ignoring symptoms only leads to bigger problems. And so I always encourage our patients, hey, if something's wrong, go get it checked out right away, whether it's your heart or your knee or your whatever it is, because, you know, with our things, we do that very well, right? If a light goes off in the car, boy, we're at the mechanic immediately. The light went off. And meanwhile, sometimes a little light goes off in the dashboard of our health, and we say, well, I'll wait. Maybe it'll go away.
That's a great analogy.
I think it's a good idea to be early.
Dashboard light goes on.
Yeah.
That's really true. I think what I did want to ask you though about is what the treatment at home, what does that entail?
Thank you. The treatment at home consists of utilizing, we have special technology that we provide to the patients so that they can neurologically provide a treatment that's about 30 minutes with that rebuilder unit. It can be done on one or both knees at the same time, depending on the patient's condition. We also provide them with an at-home qualified LED light that helps reduce pain and inflammation as well as promote tissue healing. We utilize some very high quality anti-inflammatory creams that are pro-circulatory. And also some bracing, oftentimes a stability sleeve and things of that nature. At the right time, we'll give certain exercises. And if necessary, we'll provide some equipment so that the patient can exercise at home. Our predominant goal is to use a principle that says, if I give you a fish, I feed you for a day, but if I teach you to fish, I feed you for a lifetime. And so we want to empower people that are suffering from chronic pain to be able to help themselves and not be so dependent on saying, oh, I got to go get a shot or I got to do these other things, but actually equip the patients to be able to benefit themselves and help themselves and only come in to see the doctor so that the doctor can do only the things that the doctor can do.
So Mike Rozenblum is worth your going, even if you don't have any problems with your knees, just go see him as a chiropractor. You can see he's charismatic, but let me give you his phone number again. Remember, write this down. It's 954-977-0888, and it's Dr. Mike Rozenblum. It's Rozenblum, and he's willing. He's so nice. You're not going to be intimidated, and he'll tell you, as he said. What I liked about him is he said, "I can examine you, and I will tell you in a very short time if we can help you. We're not going to take it on unless we help you, because I'm success oriented and I don't want any failures," right, Mike?
That's correct. That is true. That is true.
Well, we are glad that you were on. We'll have you on another time, but thank you, everybody. Please do this, and then let me know what happens. But okay, we'll have you on another time. So enjoy Thanksgiving, and I'll talk to you again, Mike.
Thank you. Bye-bye.